Hey, Slay Nation, it's your host, Heather, back with another episode of the So She Slays podcast. Now, if you've been following So She Slays for a hot minute, we're probably all around the same age, or we're getting to be like roughly the same age. And not me looking in the mirror the other day on the phone with my best friend being like, yo, is that a fucking wrinkle? Like, what? And I know that she was on the other end. She's like, bitch, I might have to be getting Botox. I think we're that age. Like, what the fuck? And it was definitely a moment of like, well, damn. So I know that all of us are probably at this point where we're experimenting and also researching a little bit as to like what is out there. And I know that there's like a whole bunch of questions and a whole bunch of like, well, I heard this and I tried that and so recommended this. Well, we're going to kind of get down to a lot of these questions today, but not just like your face, because we're going to talk about this with Dr. Candace. She's our guest today at the So She Slays podcast. We're going to talk about like your body too, because your face gets so much attention, rightly so. It's the first thing that people see. I get it. However, there's the rest of us, like neck and below, that it deserves some attention too. And I feel like this is a newer thing that maybe we're just paying a little bit more attention to. Anywho, we're going to be talking about that. We're going to be talking about Air Sculpt. So if you have wondered what the hell that is, or maybe I should give this a shot after learning about it, we're going to kind of get into that as well. We're really going to be talking about aging with intention and not avoidance, which I'm so guilty of. Dr. Candace, I just gave you the biggest spiel ever. Thank you so much for coming to the podcast.
Thank you, Heather. I'm so excited. This is going to be a great conversation.
This is like, I just gave a ginormous outline to our audience.
It's good. They need to know what they're getting into.
I was like, look, sit down, shut up, buckle up. We got some things we're covering today.
Yes.
I would really love to hear from you. Like, it's so fascinating to me, like why people choose to get into cosmetic surgery. So what was that moment for you? You're like, this is what I want to do with my life.
Yeah. So I have an interesting way of how I got into this field. I actually was a bariatric weight loss surgeon before I became a cosmetic plastic surgeon. So I was doing massive weight loss surgery for people, stomach stapling, gastric bypass, all the things.
Wow.
And then I would see my patients in follow-up with all this loose skin or still like stubborn spots or like stubborn pockets of fat, even after they'd lost 100 pounds. And, you know, something in me was like, I can fix that too. So I went back and did another fellowship so that I could be the girl that could fix that too. And that's what really drew me into this field, other than I'm also a consumer. So for me, like, I like to try everything. And if I've tried it and like it, then you should probably do it too.
Fact. Okay. And that's coming from a cosmetic surgeon. Because here's the thing. We're hearing all of this stuff, social media, secondhand through a friend, so on and so forth. But this is, I mean, some of this stuff is like serious things. So you're just like, I have heard horror stories, and I honestly, like, in getting whatever address that I feel uncomfortable about and want to have more confidence about, like, I also do not want to lose my life. Like, you know.
Absolutely. And so that's where these less invasive awake procedures are really like taking the industry by storm. And that's why I chose to have this done on myself, on my own body.
Okay, so let's talk about this. Let's talk a little bit about like the Air Sculpting. What is that?
Yeah. So as you mentioned, I'm a cosmetic surgeon and I do aesthetic plastic surgery. Air Sculpt is a brand or a company or a type of procedure where we are able to remove fat. So just similar to liposuction, where the fat is coming out of your body, but we do it precisely while you're awake with very minimal downtime, with no stitches and no scalpels. So it's like we kind of call it sometimes like a lunchtime lipo. Like it's similar to that in that you have solo downtime. I had Air Sculpt on myself, for example, and I operated the next day. So you can take an area of your body where you've got stubborn fat, or in now we can also attack loose skin, and you can have a procedure while you're awake, while you're comfortable, without risking not waking up to go see your husband or your children, and
Mm-hmm.
have really amazing results that show up within weeks versus months, which is what's seen with traditional liposuction. So it's basically amazing. That's what Air Sculpt is.
You're like, basically, it's the fix all. Okay, but this, I can hear some people in the audience being like, yeah, but is it like for what kind of patients? Like, are we talking like a little arm fat? Are we what are we talking here?
Yeah, so it really depends on your goals, where you're starting at, where you want to be, and what's your realistic expectation. So, someone who is, just has a couple stubborn spots, a little bit of loose skin. Obviously, those are like the most amazing candidates. I wish all of my patients were, fit, 32 years old, one baby, like all the things. But Air Sculpt actually is available and a good option for a wide range of people. So we see men, we see women after menopause, we see women and men who have lost 100 pounds of weight. It really depends on the area we're trying to target and what you want to see. Because at the end of the day, not all of us, like your mom, are willing to go through a major surgery with a huge scar and a ton of downtime. Some of us are happy with improvement and a better outcome versus doing nothing. So,
Mm.
we set realistic expectations in the consultation for what you're going to be able to achieve. And that does vary. But all that being said, you can have a very large amount of fat. Like I can take off 4 liters of fat in someone. So it's
Wow.
not just for the tiny girls, it's for everyone.
Yeah. And that's so amazing because like offline, Dr. Candace and I had a little conversation about like, it's we're at this stage, I feel like, in technology where this stuff is a very viable option. Because the thing is like we've all, I'm sure if anybody sat here and thought, they were like, oh, I know somebody who's gone through a cosmetic procedure, like an actual surgery.
Yeah.
And my mom was one of them. I mean, she got a tummy tuck when tummy tucks were a thing, and those were like a full my poor mother could not move for like a week or two. Like she
Yeah.
was just like, it was a thing. I mean, she had done the menopause thing. She had 3 kids. Like,
Yeah.
I love it for her, but that was some serious surgery.
Yeah. And it doesn't have to be that way. For example, even if you do have a little loose skin, at AirSculpt, we offer something called the tiny tuck. So, where we can still remove a little bit of skin so that you have that flatter, smoother appearance of your skin without going under. So, there are so many ways to kind of get to that end goal of a better silhouette, a better contour without the crazy risks of general anesthesia, big surgery, and big scars. And that's why it's so great.
I mean, I love that. So can you kind of talk me like you're like, oh, it's the lunchtime lipo, so on and so forth. I mean, is this just injections? Is this like, I
Yeah,
mean,
great
because
question.
I think this is, and this may be a double question because we've all seen, the horror stories of like a CoolSculpt or something like that,
Yeah,
where it's like it was
yeah,
just not done in the way it was supposed to be done, like so on and so. So it's like again, it's like I know that people can get confused. One, similar names. Two,
yeah.
kind of treating similar things. So it's like, can we just like distinguish this for a minute and also give people what to expect?
Yes, absolutely. So the word you said before, cool sculpting,
Uh-huh.
that's a topical procedure. It's not invasive at all. They're sticking a machine on your body where you have fat that you don't like, freezing it, and hoping your body's going to dissolve those fat cells. This is completely different. This is a procedure where you will come to the office, you will meet with your surgeon, you will plan your procedure date, and on that day, We'll mark the areas that we're targeting. You'll get some medications to help your body to relax, to prevent any discomfort, and to prevent any nausea. And then you'll go into a treatment room where I'm then going to use small tools, like teeny tiny tools, to put in some local anesthetic and help the fat to dissolve, but then I'm mechanically removing it. So I'm actually plucking out the fat cells, cell by cell. They're going
Wow.
into a canister, just like with, traditional liposuction. So we're taking the fat away. We're not just hoping your body's going to dissolve it. Okay. And the fat that goes into the canister, you can see. I have patients take selfies with their fat canisters all the time. So
Dang.
this really works. Like, it's actually happening. The fat's coming out. And then we have the added bonus of, like, after I take that fat out in that same plane, so under your skin where the fat was sitting, I can run a device and tighten the skin at the same time. So you can get 2 for 1. And then you do this all while you're awake. We're playing music, we're talking. A lot of times we'll, discuss like what's going on in the world. We'll talk to the nurses, we'll talk about ex-boyfriends, like whatever you want to talk about. It's also your therapy session. And then the procedure's over. I literally every day I have someone say, "We're done already," because you're so relaxed. And then we put you in your
Mm.
garment, you go home. I went shopping after my procedure. Probably, you're supposed to rest, but you can go shopping if you really want to. And then you slowly start to see your results over the next days to weeks. And that's what Air Sculpt is. It's not
Mm.
traditional lipo where you need general anesthesia. You've got aggressive, large tools that can cause damage. And it's not CoolSculpting or a topical fat removal procedure that doesn't actually work or can cause more damage than good.
Mm. That's so amazing to me that like people, because I would think that like you would need like downtime. You would need I'm like, you're like, these are tiny tools. I'm literally removing fat cells. Like, it's so crazy because I think everybody has an image of their head of like liposuction and
Yes.
like the needle or whatever it is being like in and out of the
Yeah.
body. I mean, Lord knows I have watched like the TLC programs in which you see
Yeah.
the behind the scenes.
I mean, we are using tools, but they're just a better tool. Just like you are
Mm.
on the iPhone 17, like the AirSculpt tools are just better. They're more precise, they're more delicate, but they're still effective. Like, we're still getting the job done so that you can see a beautiful change in your contour.
So, okay, talk to me. Like you said, we can do this all over the body, right? Like, this
Yeah.
is
Basically from your chin to your ankles.
sweet. That's
Yeah.
amazing, honestly. Um, Also, too, I'm thinking like, okay, Air Sculpt is, because I haven't really heard about it that much. Is it relatively new?
The technology is somewhat new in that, like you said, not a lot of people know about it, but it's actually been around for a lot longer than you think. Like, we're going on almost 20 years of this, specific type of technology. We've just finessed it
Mm.
along the way. We've gotten better protocols. We've gotten, like, we have better surgeons, like all the things that have advanced, just like, time and all of our updates with our software. AirSculpt is really the best thing on the market right now for non-invasive or low-invasive body contouring and skin tightening.
Okay, so if someone were to be like, I am interested, you had me. How do you go about finding the right type of person for you? Like, right type of doctor, right type of surgeon who can do this and like, you're not having a horror story experience.
That's a really good question. And, people really do need to do their research. So if you want AirSculpt specifically, go to the AirSculpt website. Like, honestly, that's the easiest way. And then find the location that's closest to you. Because we now have like 32 locations. There's basically almost one in every state. And the surgeons at AirSculpt have been vetted. They have been trained. They are board certified surgeons. You're not going to get that horror story because surgeons that work at AirSculpt have done thousands of cases. Like, this is our jam. This is what we do. We are body surgeons who know how to contour, tighten, and tone. So once you get into an AirSculpt office, it's pretty much you're good to go.
Wow. Okay. I mean, that's like probably like the easiest thing to do.
Yeah,
Is
it
there like,
truly is. Yeah.
what do you recommend, any questions that somebody should ask, like at their consultation or anything like that? Like, what are the things that we need to be asking or wondering about before we're even like on the table doing things?
I think really come with like, look at some before and afters on the website. See if you see people who have similar body types to you. And if you see someone similar, show the surgeon, talk to the surgeon, tell them what kind of result you would like, and ask if that's reasonable or realistic. Like, obviously we can't take someone who's 6'2" and 300 pounds and make them look like a 5'2", 110-pound person. Like, there are limitations based on your baseline anatomy. No, it's a real thing. Like, we have
Really?
to be in
I was like,
line.
really?
We have to be in line. But most of the time, you're going to get a surgeon who's able to answer your questions, like let you explain what you want to see. And then we meet in the middle. Like, okay, I know that this is what you looked like before. You've had 3 babies. This is what you'd like to look like. This is where I think you can realistically get. Like, that's the kind of conversation you want to have. And the other thing is, if you're on the fence about something, just ask. Like, I know when I had a consultation, I forgot that I had mentioned to the sales consultant that my ankles bothered me. And I'm sitting with the surgeon and she goes, "Candace, don't you want to bring up your ankles?" And I'm like, "Oh my gosh, yes." So like, write down what you want. And now I'm so glad that I did that area. Like, life changing, literally, cankles be gone. And just write down what you want to ask, because in the moment you can get nervous and you can
Yeah.
forget things, and then you don't want to regret not asking or having that evaluated at the time, because yeah, maybe you don't want to do 5 or 6 areas, but you want to know what is an option and what's not. I think that's good, just to plan ahead.
I think so too, because I think there's, I mean, that happens so much, right? We get into
Yeah.
the information and we totally forget what the heck we were supposed to be asking. I like, with the women or people, I should say in general, that you treat with Air Sculpt, like, what are they actually asking? Are they just like, I have stubborn belly fat, I have like fatty arms, I have like whatever it is, like what, and like what is like the realistic thing? Like, cause I just feel like you have so many stories where you're just like the example you just gave.
Yeah.
And I was
Yeah.
like, oh my gosh, that people really like come in and are expecting that. So I'm just trying to be like, what are people like really asking for? And like, what's the scope of this?
Yeah, I mean, at the end of the day, most people are asking for a confidence boost.
Mm,
And it's like, what is going to make me feel good about myself? Or what have I been staring at or thinking about every single day that's nagging me that I just want to shed? Like, we have a lot of women and men come in after divorce or in the middle of a divorce, and it's
look,
like they've got all this negative energy in their body and they just want to transform. They want to become a new person. And while they're not going to look like a new person dramatically, these little tweaks change people's lives. Like, they like feel like a butterfly out of cocoon. So the areas they ask for vary. It's because it's all based on that person, like
mhm,
what they see in themselves that bothers them, what's their like flaw, or what's the thing that's you know, hanging in the back of their head every day. But
yeah.
the most common is like the tummy. It's a hard area, especially with women after babies, going through hormonal changes. We just hang on to fat there, no matter how much we diet, no matter how much we exercise. And the GLPs get our weight down, but then we still have these stubborn pockets. So
Mhm.
the tummy, the arms, under the chin, like these are areas that are somewhat like visible to the world. Like, if you've got a tummy, it shows in your dresses, it hangs over your pants. The chin we see on all the selfies we take these days. And the arms, like, I'm in Florida, so we have our arms out year round. So it's
Yeah.
areas that, yeah, it's areas that we are so self conscious of that people come in and want a little something for.
And it's so understandable. I feel like this is like such a practical solution to a lot of like insecurities that people have.
Yeah.
I would love to try to transition a little bit to like aging with intention and like aging in avoidance, and what exactly you mean by that, because I think all of us unintentionally age in avoidance.
Right. Right. Yeah, we're all getting older, and it's unrealistic to think that we're all going to stay looking 25. But at the same time, we want to feel good about ourselves. So we need to have that intention to do little things for ourselves along the way so we still feel as though we look like we do on the inside.
Mm,
No one wants, I mean, some do, but nobody really wants this massive, huge change. Like most of us want to look the way we've always looked, but without getting worse.
mm,
So, thinking about what you want to see in the mirror, as we get older, when we go through changes, especially after babies, like I just had my eyes done, for example. I
mm.
noticed that I know you can kind of see the scars still
I was like,
because
I can't even actually.
I'm
I'm
less
like,
than
the
2
makeup,
weeks
the makeup
out.
does a really good job. I can't even tell.
Yeah, I'm not technically cleared to wear makeup, but whatever, we're fine. Um,
I figure
no,
you're a cosmetic surgeon. You would know.
I'm like, the incisions are healed, we're good. But it was something that always bothered me. Like ever since I had my second child, like I just felt like the pregnancy, my eyes swelled and then the skin it was hanging weird. And then I see my dad who has these awful hanging eyelids. And I'm like, I
No,
need
you're
to
like, oh my
prevent
God,
that
it's
now.
genetic. It's genetic.
Yes.
You're like, I'm over this.
Yeah. So, I intentionally thought, let me prevent this before it gets too bad. And I am unrecognizable when I go from 0 to 100. Like, let's just do something simple, something small. I was able to do it awake, just like an air sculpt procedure, and get back to work the next day. And I think if think realistically that you want to be the same person, but just maybe an elevated version or a more confident version, then you're approaching things the right way.
Mm. Okay, let's talk about that a little bit, because I feel like there's a mindset and there's also a little bit of, I would say, a taboo discourse even still in
Yeah.
regards to this, which
Mhm.
drives me insane because I don't really, I'm like, at this day and age, really, we're still here. But look, that could be said across the board for a lot of things.
For
Um,
sure. For sure.
so my thing is like, let's talk about this. Like, what our mind shift um should be in going to do something like this, or any cosmetic procedure.
Yeah. So my biggest thing is like, don't make a huge, crazy, rash decision. Don't do something for someone else and don't expect to look like a totally different human.
Mm,
So each of those things, like, have realistic expectations. And if you're coming in to see a surgeon because a guy on the street told you need bigger boobs or a bigger butt or smaller this or smaller that, no, just no. It needs to be your decision for you to make you feel good about yourself. And then don't make quick decisions. Like, think about this procedure, because at the end of the day, whatever we're doing, you have to follow through. A procedure is going to happen, but you can't, for example, go have a massive like body transformation and then eat Chick-fil-A 3 times a day afterwards. Like, you're not going to keep your results. It's not going to look good. You're going to feel like you wasted your money. Like, you have to do things like with intention and thoughtfully, so that you're investing into your body, but you're investing into your health as well. And then,
mm.
just don't don't do it for other people. I think that's my main thing. Like, be thoughtful, like know that you're doing something for you.
Yeah, I think that's very, very important, and that's when you know you're doing it for the right reasons too, is
Yeah,
when you can check in with yourself and being like, this is just what I want. I've literally sat and thought about this for years upon years, and sometimes it's not years upon years, but I guarantee you it's been in the back of your mind for a minute.
for sure. Right. Right.
I was like, I guarantee you, because even on my own body, there's somewhere I was like, I'm gonna have to address that one day. Like,
Mhm. Yeah.
that's a thing I'm gonna have to do something with.
Yeah,
And I
right.
joke all the time because I'm just like, look, I'm not above the cosmetic procedures because I'm like, look, Jane Fonda looks amazing at 91. All right.
Mhm.
She
Mhm.
looks
Yeah.
phenomenal.
Right. Yeah, I mean, we gotta give it to these people that are, setting some type of standard, because you don't have to age ungracefully in this day and age.
Mhm.
You can do stuff safely. You can do stuff without people knowing, if we want to still stick with this taboo situation. But honestly, I'm super open about what I do because I want people to have confidence to change themselves if they want to. There's no
Mhm.
pressure. If someone comes to see me, this is one thing. I do all types of cosmetic surgery, and I'll have women come to me about their breast. Okay. And
Yeah.
most women today don't want an implant, but I get the comment all the time, I thought you were going to tell me I needed or I had to have an implant to get a good result. And it's like, no, girl, it's your body. Like, I'm not going to tell you that you have to have this foreign thing put in you if that's not the aesthetic you want. And if that's not your goal or in line with your expectations or your long-term results. So, it's really all about picking the right provider. I think is super important, but then being real with yourself. Like, what do I want to live with? What do I want to look like long term? Things like that, but being honest and true to yourself.
I think, okay, we're going to touch on that just for a second before we shift gears here.
Yeah.
Because I think we answered this, but I'm wondering if people actually got it as far as like finding the right provider. We talked about how to go about doing it, especially for Air
Yes.
Sculpt,
Yeah.
but in knowing if that person is right for you.
Yeah. Okay. So this is deeper. It's deeper than that. Uh, I mean, I'll be so honest with you. I pick people based on the connection that I have with them.
Mm,
And I feel like if the person can make eye contact with you, can talk to you, can honestly tell you what they think your result is going to be, and they have confidence, they've obviously got the credentials and they're, a good provider in that sense. It's kind of about feelings and vibes and like knowing that the person you're going to connect with, because at the end of the day, it is kind of an energy exchange. You want to be comfortable with that person and know that they care about you and care about the work that they're doing and the long-term results. So that's why I connect with a lot of women, because I've been there. I'm a mom, I'm married, I work, so I can relate on so many levels with the
mhm.
people that I take care of. And and I think it shows to them that I care about what I'm doing. And I think if you can find a provider that's on the same level with you that you can connect with, then that's really important. And I know it's a brief conversation sometimes, those consultations, but I think you can sense the energy a lot of times really quickly.
Yeah, agreed. Go with your gut instincts for sure. I would love to kind of shift the gear a little bit to anti-aging talk and how we always talk
Mhm.
about our face and not really our bodies, and then kind of like what someone in their 20s versus 30s versus maybe early 40s should be addressing when it comes to anti-aging and their bodies.
Yeah. Okay. So I'm going to start with like, let's do like decades. Okay. So,
Yes.
like 20s and 30s, what should you do? I think the most important thing is to wear sunscreen if you care
Mm,
about your skin and freckling and wrinkling. That's super important. But also to stay really hydrated, exercise, and try to keep a steady weight, because it's the fluctuations in the weight, like the really big ups and the really big downs, that really wreak havoc on the skin and can cause
mhm.
stretch marks and cause hanging loose skin that's kind of hard to deal with and doesn't necessarily always get better if you have a ton of yo-yoing in your life. So,
Mm,
if you're someone who struggles with their weight, don't do the crash diets. Don't do the things that you're going to drop 20 pounds in 2 weeks, because it's not healthy, it's not safe, and it can really mess up the exterior, your skin
yeah.
and all of the things. I think that's important, exercising just to like keep your muscle mass up so that your shape is good, hydration so the skin looks nice, but then that SPF component so that you don't get all the blemishes and the marks as you get
Mhm.
older. Once you're in your like 30s and 40s and going into the 50s, it's about like, doing little things along the way. Like, okay, let's start using a retinoid on our body, something that increases the
Mm.
cell turnover, that ups the collagen. That's a great option. You still need to be doing the SPF, you still need to be exercising. But when you're in that like middle, or I don't want to call 30s middle age, but they kind of are, because honestly, our
I
collagen starts going
know.
to crap at 35. So let's just face it. And you need to start doing some lasers. You need to start doing little procedures that are a little bit more aggressive, because they're going to like turn back time, and they're going to prevent things from getting worse really, really quickly when the
Hmm.
hormone changes start happening. So I think that's important. And then in the day that we're in now, we have the availability of peptides, like stuff that we can do internally that's going to increase the collagen, help our hair, skin, nails, like even really good vitamin supplementation if you're not into the peptides and injecting and things like that. There's so many things that we have at our fingertips today that they didn't 20 and 30 years ago, that obviously speak with an educated provider, do your own research, but there's ways to maintain and look really good for longer that we didn't know about before. And then obviously this is where like you may or may not need to start doing little procedures if you've had a baby. This is a good time to consider a, body contouring procedure, a skin tightening procedure. And then eventually, we just age gracefully and wear our frou-frou night creams and call it a day.
I mean, I'm here for it. I'm here for it. And I think it's so interesting because I don't think, again, we are always referred to the face and what we can do with our face when it comes to aging. My thing is like, okay, our body, obviously, huger portion
Yeah.
of who we
Right.
are, right? And so
Yeah.
it never occurred to me like maybe you should use a retinoid. Is this something like along the lines of like, okay, do I just mix this into my body lotion after a shower or something? Or like what is this?
Yeah, you really want to get one that's designed for the body. So the component, it'll be a bigger jar, so it's going to last you a lot longer. It's going to have the right concentration. It's going to be formulated for that skin, which tends to be a lot thicker than the face skin. And it's at a dose that can go that large area without having any, toxicity per se. So look for retinols and retinoids that are designed specifically for the body. And you always have to make sure if you're using a retinol that you're also using a sunscreen, because that cell turnover does make your skin more sensitive. So you've got to do both, but both are going to make your skin look a lot better than it would had you not in 5, 10, and definitely beyond those years.
Oh my gosh, I recommend not me hearing everybody going to like Google and like AI
Right?
and being like, what are some body
Yeah.
retinoids or peptides or whatever? Because
Yeah.
I mean, I'm gonna have to now. I'm like, now
Yeah.
I know the information. I have to
Right. Yeah.
check.
You know what I love too? I love putting a copper peptide on my face. It makes your skin glow. Like I'll do the peptide injectables because I have them in my office, but I'm not consistent with them because I'm a little bit lazy. But I have copper pads that I swipe on my skin, and it just feels so good. And then people tell me like, "Oh, what are you doing to your skin? What are you doing to your skin?" I'm like, "It's just these copper pads. I sell them, but like you can get them online, I'm sure." That I love doing, and then I love a retinoid body cream. It's
Oof.
just preventative.
I'm here for it. I'm here for it. Okay. We are moving into the interview section where we come to the close with rapid fire
Oh my god,
questions.
I'm nervous.
Oh my God, don't be.
Don't want to be too long-winded. Okay, we got this. I'm gonna keep it brief.
Sometimes they are like, okay, I will forewarn you. Sometimes people are like, this is not rapid fire questions. And I was like, just do your best.
We're gonna do our best. We're gonna do our best.
Okay. So, best cosmetic surgery or biggest cosmetic surgery myth that you are so overhearing?
That you need to have a tummy tuck if you want to have a great abdomen. Like, no, you don't. You can have a little lipo, you can have a little skin tightening. Like, you don't need to have major invasive surgery to look good and feel good, period.
Mm, facts. Okay. The one thing you wish someone had told you before you became a surgeon?
That it's more of a psychology job than it is a surgical job. So obviously my
Wow.
technical skill is very important, but I'm going to be honest with you, girl. I do a lot of counseling. Like I see women who are down and out and like really struggling through different parts of their life. And that's how they end up in my office.
Yeah.
Obviously, we have real conversations about doing a procedure before we move forward if they're that upset about something, but I do a lot of therapy. I do a lot of therapy, and that's something I didn't know before I got into this specific industry.
Oh my goodness. I mean, I guess that kind of makes sense in hindsight,
It
right?
does. And especially when I'm doing the awake procedures because we talk the whole time. Like, girl, people will dump their like deepest, darkest secrets. And, sometimes it's really great and it's exciting and it's like a fun conversation, but sometimes it can be really heavy. And I'm happy to be there for people, but it's not what I expected sometimes for sure.
This is
Yeah.
not what I expected.
Yeah.
Okay. So if you if someone came to you tomorrow and said, I think we addressed this a little bit, I want to look like my 25-year-old self, what would you say to them?
Girl, you don't need to look like your 25-year-old self. You need to look like you today, but the confident version of yourself. So if you need a little tweak, if you need a little nip, a little tuck, something like that, I got you. But you don't, we don't need to rewind the clock, to a specific date. The glory days are over. We have better days ahead, and let's focus on that.
Um, if you could tell your 25-year-old self anything about how you should be taking care of yourself and your beauty in this process as you age gracefully, what would it be?
I would tell myself, stop following the trends, do the stuff that's tried and true. So really look at data, look at research, don't crash diet. Girl, I did so many crash diets. And hydrate. Hydrate, hydrate,
True.
hydrate. I don't hydrate my skin enough. I wish I did. I wish I did when I was younger too. And I think that makes a huge difference because I see people who are really great at that and they wear their SPF and all these things and they look like
Yes.
15 years younger than somebody the same age. It's crazy.
It's a thing. SPF is
Thing.
definitely a thing. Highly
I
recommend.
know. I know. Listen, I'll go down the path where I see like you shouldn't wear SPF, it causes cancer and like, it's a chemical and like I hear that, but also I see the results of someone who uses sun protection, especially on the face, the chest, the hands, and it's like, okay, but like their skin looks really good.
I always combat it with like, okay, yes, however, the sun and the ozone layer are not what they were like
Correct. Also
back
that.
then.
Also that.
So,
And there are so many clean options you can use. Like we can use like just
yes.
a mineral sunscreen that's a mineral. So it's fine. But yes,
There's options. There's
there's
options. Okay.
options.
Last question. What's something about aging that you're actually really excited about?
I'm really excited about skin tightening. Like that used to not be an option. Like even when I was
Mm,
doing some of my training, it was like loose skin, sorry, you need it removed. You have to have it cut away to have a good result. But the technology is getting there. It's truly getting there. And we're seeing major changes. And that's how things like Air Sculpt are able to exist because we can use technology to our advantage to get great results with lower downtime. And skin tightening is one of those things that keeps getting better and better every year. Like every year, I'm seeing better and better results.
wow. Oh my gosh. We're all going to be looking phenomenal. And we're
Yeah,
like in
girl.
our 60s. Like,
Yeah, girl.
goals.
Martha
Oh my
Stewart, right?
gosh. Thank you so much for joining us, Dr. Candace. I really appreciate it. I feel like we covered so much in such a
We
short amount of
did.
time.
Yes.
But I'm hopefully like Slay Nation, hopefully this was a nice little, surface level dig for you when it comes to anti-aging and your body. Dr. Candace, where can people find you, follow you, all the things?
Thank you, Heather. This has been super fun. I am the Slimming Surgeon on Instagram, TikTok. I have a YouTube channel because I also have a podcast, but Slimming Surgeon is the easiest. They can message me, DM me, whatever, and I'd be happy to connect. I answer all my DMs. So
Love it.
Love it.
Slay Nation, thank you so much as always for listening. And also remember that So She Slays has a Patreon, So She Slays Unfiltered AF, where you can get all extended content for both of our podcasts that we have. As always, definitely follow us on all the socials. So She Slays across the board. We're SoSheSlays.com, where you can get our editorial site as well. Like, comment, subscribe so that this episode reaches those who want to hear more about it. Thank you so much, everyone.
Yay.